We're joined now from Norwich by the Liberal Democrat health spokesman Norman Lamb. This weekend they made their own health announcement promising a 1 percentage point rise on every income tax band to fund the NHS. Norman Lamb, do you welcome the Conservatives putting mental health onto the campaign agenda in the way that they have?
I welcome it being on the campaign agenda, but I fear that the announcement is built on thin air. You raised the issue at the start about the 10,000 extra staff and questions about how it would be paid for. There is no additional money beyond what they've already announced for the NHS. And we all know that it falls massively short on the expectation of the funding gap, which by 2020 is likely to be about 30 billion. That's really not disputed now. And anyone outside the government, wherever you are on the political spectrum, knows that the money going in is simply not enough. And so, you know, just rather like the sort of claim that they would add 5,000 GPs to the workforce by 2020, that isn't on target. In fact, the latest figures show a fall in the number of GPs. So, you know, they make these claims, but I'm afraid they're without substance unless they're prepared to put the money behind it.
And your party's solution to the money problem is to put a 1% percentage point on all the bands of income tax at 20, 40 and 45 to raise more money. Is that fair, though, in that most pensioners who consume 40% of NHS spending, but over 65s, they only pay about 20% of income tax. So are you not penalising a younger generation for the health care of an older generation?
Well, Andrew, it's the first step in what we're describing as a 5-point recovery plan for both the NHS and the care system. So for what's available to us now, it seems to us to be the fairest way to bring in extra resources. Income tax is a progressive tax. It's based on your ability to pay. For your average British worker, it would be £3 a week. That's the cost of less than 2 cups of coffee a week. But in the longer run, and we're saying that by the end of the next Parliament, we would aim to introduce a dedicated NHS and care tax based probably around a reformed national insurance system so that it becomes a dedicated NHS and care tax. And interestingly, the former Permanent Secretary at the Treasury, Nick Macpherson, has said clearly that this idea merits further consideration. That's the first time anyone for the Treasury has sort of bought into the idea of a hypothecated tax in that way.
Treasury, but let me ask you this. You say it's a small amount of tax that people on average incomes will have to pay extra, but we're talking about people who've really seen no real increase in their incomes since 2007. They've been struggling just to stand still in terms of their real pay. And yet you are going to add to their tax. And as I said earlier, most of the healthcare money will then go to pensioners whose incomes have risen 15%. I'm just interested in the fairness of this redistribution.
So bear in mind, first of all, Andrew, that the raising of the tax threshold that the Lib Dems pushed through in the coalition increased the effective pay in your pocket for basic rate taxpayers by about £1,000. We're talking about a tiny fraction of that. And I suppose you have to ask, we all in this country have to ask ourselves the question, are we prepared to pay, in terms of the average worker, that £3 extra a week in order to sort of give us that guarantee that when our loved ones need that care in their hour of need, perhaps a suspected cancer, that care will be available for them? I've had 2 cases recently brought to my attention. An elderly couple, the wife has a very bad hip. They just couldn't allow that wait to continue. She was told she'd have to wait 26 weeks. She was in acute pain. They've ended up paying £20,000 for private treatment to circumvent the waiting time. Now, and they hated doing it because they didn't want to jump the queue, but that's what's increasingly happening. We're seeing
I'm sorry to interrupt you, Mr. Lamb. You make very good points, but we're very short of time today, so I just wanted one final question to you. It does look as if you won't get the chance to do any of this, because I'm told now the best you can hope to do internally, you think, is to double the number of seats, which would only take you to 18 seats. And do you think that promising to raise people's income tax, even those on average earnings, is a vote winner?
Look, I think actually people in this country are crying out for politicians to be straight and to tell it as it is. And we're at the moment heading towards a Conservative landslide. But I ask the people of this country, do we actually want a one-party state? And we're electing a government now not just to deal with the Brexit negotiation, crucial though that is. We're electing a government to oversee the stewardship of our NHS, the funding of our schools, all these other critical issues. We need an effective opposition. And with the Labour Party having taken itself off stage, the Lib Dems must provide that effective opposition.